Concept of control. So here we are talking of controlling the disease. Like it refers to a set of ongoing public health actions which are aimed to reduce the impact of infectious and non-infectious diseases within a population. So these measures are designed not only to limit the spread of disease but also to lessen its severity and consequences and the societal burden. So what are the objectives? Objectives are, number one, we have to reduce the prevalence of illness. We have to shorten the duration of illness, minimize the consequences, and elevate the financial burden on the community. It means we have to reduce the healthcare costs and we have to support the sustainable health system. So prevention strategies are again primary and secondary prevention. Tertiary prevention is also equally important because it plays a less, though it plays a less prominent role, but still very important for individual rehabilitation, and it is focusing more on clinical recovery and disability management of the disease. Then we talk of disease elimination. Also disease elimination means we have to have a goal that is not controlling the disease, but we are having the goal to completely eradicate and eliminate the disease from the population. Like we were working on polio, like we were working on malaria, we are working on covid, right? So we are having the goal to completely eradicate or eliminate the disease. So significance is that it does not require any global extinction of the disease agent, but we should have zero incidence of the disease in a specific region. It is considered as prerequisite step, means first step towards global eradication. So for example, measles, polio, diphtheria. So measles are eliminated from certain regions through mass immunization. Polio is eradicated from most countries, and diphtheria, it is controlled and eliminated in many parts of the world due to vaccination programs. So strategies for elimination of disease is vaccination, robust surveillance system, rapid outbreak response, and cross-border collaboration and monitoring, means collaboration and monitoring among the countries. So next word is disease eradication. Disease eradication means permanent removal of disease and its causative agent. When we were talking of elimination, we were not talking of causative agent, but here when we are talking of eradication, we are talking of causative agent also. Permanent removal of causative agent means we have tear out the disease by its roots. So eradication is absolute outcome. It is described as all or none phenomena, means if there is causative agent, the disease will be there. If it's not, then it is eradicated completely. So criteria is that the disease with no human reservoir, no non-human reservoir. Non-human means the inanimate objects that we talked of, that they should not be there. Availability of interventions, vaccinations should be there. We should have diagnostic tools and we should have global coordination among each other. Then achievements in this, then smallpox. Smallpox is the only disease fully eradicated worldwide, but here personally I don't think so that it is fully eradicated, because in our lives the our children had smallpox in their lives, right? So though it's written in the texts and books, but personally I don't think so. Other diseases which show promising progress towards eradications are polio, measles, and dracunculiasis, that is guinea worm diseases. So yes, the polio eradication is considered more feasible in the near terms, and there are international efforts behind that eradication. Next comes monitoring and surveillance. Monitoring and surveillance means the public health professionals should follow the monitoring of people. The monitoring means they should observe the environmental indicators, they should observe the population health metrics, and they should follow the health service performance, so that they can provide the feedback loops which requires continuous improvement in healthcare delivery and public health programs. Next comes our surveillance. Surveillance means ongoing examination of variables that influence the occurrence and distribution of disease. So it refers to active, authoritative observation of health related variables. Means it is often associated with vigilance, epidemiological vigilance, and it includes surveillance, demographic surveillance, and nutritional surveillance. Surveillance means we are just examining the variables. Okay, we are observing that the disease may not occur. So for that, we have to track the infectious disease outbreaks, we have to monitor population changes, health disparities, and we have to also assess the food security and malnutrition trends. So main objective of surveillance is to provide timely data on emerging health trends. We have to offer actionable feedback to provide to inform the policy makers and deliver early warnings to public health emergency system. So under surveillance, we have the term sentinel surveillance. Sentinel surveillance means this is routine, the routine surveillance may interrupt or may miss undiagnosed cases. But to address this gap, sentinel surveillance is employed. So it refers to the targeted collection of data from selected reporting units like hospitals, clinics, and labs, so that they can identify the trend and estimate disease prevalence in a particular population. So here the features of sentinel surveillance includes that they focus on strategically chosen sites that represent broader population dynamics, like hospitals, clinics, and labs of certain city can give the idea of the health of that population, the population residing there. It captures underreported cases. The data is extrapolated to estimate prevalence, and particularly it is used for influenza surveillance, AIDS monitoring, and vaccine preventable diseases. So how can we evaluate the control? So evaluation is also important. Evaluation means it is used to determine effectiveness and efficiency of disease control programs, like the strategies. If we are imposing strategies, we are making the policies, so what impact they have and how are they working, or you can say how the departments are working who have been given the responsibility of any disease control programs. So it is a systematic comparison between actual outcome and the planned objectives. It helps stakeholders to understand whether interventions are achieving their goals or not. So the purpose is to assess the performance of control measures, to identify gaps, to guide the policy makers, to ensure accountability and continuous improvement. Then what are the evaluation metrics? We have to reduce the disease prevalence, improve health outcomes, we have to make the interventions cost effective, community satisfaction should be there, and timeliness and coverage of services. Then how can we evaluate? We can have the process evaluation, means how the program is being implemented. Outcome means short-term effects of the intervention can be measured, and we can also assess long-term changes in the status of the health of people. So evaluation, when applied in disease control, it helps to determine whether primary and secondary prevention strategies are working or not. Surveillance systems are detecting cases effectively or not, how well the monitoring tools are working, and whether the program is cost effective and scalable or not. So this was all with your control of evaluation of control.